All right, we are back with another video on how to take care of injuries at home. So we've done a lot of extremity videos and now we're going to move into the spine a little bit. And the first place that I wanted to start is the neck. So a lot of people come to me with neck issues and the general complaint is going to be pain somewhere from the base of the head down into the shoulder or down between the shoulder blade and the spine. Now this isn't going to be a catch-all because there are a lot of different things that can cause that. But probably the most common thing that I see is people spend most of their days either with their arms in front of them driving or at a computer with their right hand on a mouse. And what happens is the anterior compartment or the anterior part of the shoulder ends up in this flex position all day long. And then if you work out and you do a lot of pressing movements, like let's say a lot of bench press or push-ups or burpees, we're back into that pressing maneuver and the posterior side typically tends to get neglected. So what happens in a lot of these instances is as we stay in a flex position and our head's down or forward, that head's roughly 8 to 10 pounds. And the analogy that I give people is if I handed you an 8-pound, or if I hand you an 8-pound weight and ask you to hold it like this all day, this would be the source of my pain, but my pain would be here. So the same thing, as my head goes forward and my shoulder gets rounded, my pain's going to be back here, but this is going to be the source of my pain. So a lot like the bicep impingements, the best way to address that is we want to try to open up the front of the shoulder and stretch it out. And that's actually going to relieve the pain back here. So people will come to me and they've been rolling or they've been digging into their upper trap or shoulder right here trying to get relief, and it just continues to come back. And that's the reason. So we have to address it from here. So the way that we would do that is a lot like that bicep impingement video that we showed, where we're going to come into the chest and just get into a door frame or something and take that ball and kind of stick it where the shoulder comes in and kind of sinks into the chest, and then just work on a lot of pressing and externally rotating and then coming out and stretching out the chest here. When we get into this position, we got to think if we're 6 or 8 hours in a flex position all day, we want to spend probably 2 or 3 minutes trying to stretch this out after we break it up. And that will help to relieve a lot of that pain. So that's our tip for today. Same thing, if the pain continues or it interferes with your work or activities, 2 to 3 days in a row, it means you probably need to seek out some professional care. So anyway, have a good day. Thanks.